Hello guys. So looking poor and then thinking small are the two important things that you require to become big. Okay, let me explain you. This is a contrarian theory. So most of you would be telling you that if you think big and if you think extravagantly, maybe then you'll actually become big. But I'll try to explain the concept which I'm going to tell you in a methodical way. So this video is for mainly the MBBS students who actually passed your MBBS and MD people who are actually starting your practice, and mainly for younger doctors. And some doctors are like 70 80 years experience also would get benefited by this particular video. So let me tell you one particular important thing. So why first let me tell you why thinking small actually helps you in growing. So I'll tell you an example: a young MD doctor who has started his OPD in, for example, tier 1, tier 2, wherever you see, and then he got all the imported furniture, all the high tech interiors and all that, and two or three receptionists and all that he has done, and some kind of a digital app which actually helps him in monitoring his patient's progress and all that he has done. But unfortunately, at the end of it, is not able to see two to three patients also. So then he has taken a lot of money to build all these things, and then he has to pay interest on the debt that he has taken, and he's not able to produce some positive cash flow. It has gone into negative cash flow, and then the system collapsed there. He need to shut down the OPD. So what I'm trying to tell is, you have to think small here. So I would like to tell you another alternative story. So if you take a small modest OPD of 150 square feet, smaller one, a table and few chairs, and maybe one assistant. Okay, so you're only catering to area where you're trained in. For example, you are endocrinologist, or you are, for example, a general medicine guy, and then you can actually start with a small setup like this, and then you can grow bigger. If the patient flow is increasing, then maybe you can hire one more receptionist, one nurse actually to give some IV fluids, and one maybe examination table or some treatment or some diagnostic center attached to that. All these things can be done when patient flow is increasing. So step by step actually you have to increase. So that is actually think small. So think small first and then slowly grow on top of that. In this way, you will never go into negative cash flow. You will always be in a positive cash flow. In all my videos, I preach saying that you have to develop digital presence, you have to have branding and all that. Even so, many people I'm seeing, they're renting studios, they're conducting fancy podcasts, and then they're wasting all the money. So all these podcasts will just extract money from you. Each podcast will take 30 to 40,000. You need professional cameras, lighting, and editors. They'll squeeze money from you. You just need your phone, that's it. So I always tell digital presence is very important. For that, no major stuff is required. One small laptop and a phone. You record in your phone, just a clean background and a good voice. Okay, that's enough. And maybe one video in a week is enough, and you can learn editing. How to do editing? If you type in YouTube, so many videos will come. Or if you want to learn from me, I can teach you how to do editing. I think I'm doing a workshop in the next anesthesia conference about that. So that is these are this is how you have to think small. Start building on that, and for example, you have built a channel and you are getting a lot of patients, a lot of revenues there to invest in marketing. Then you make all these studios and all those things. Then it makes sense. Even then, I feel the digital presence should be more of a content based than the production based. That is what I feel. Okay, so this is about the think small and grow step by step organically. Okay, and then is a think poor. So think poor is more like what even if you have money, even if you have a lot of resources and all that, don't show off by spending a lot of money on your watches and cars and all that. Anybody can buy putting an EMI. Okay, so it is not about that. It is all about having an emergency fund, then having some element of money saved in mutual funds and stocks. And I've done so many videos you would have watched in crypto and all this gold and all that, I would tell. So saving money in the initial phase is very important, because if something happens to your OPD, or if your practice is not picking up and all that, or if your picked up practice suddenly falls due to some reason, or if your health is not permitting to work harder like before, all these possibilities are there. No, so if you have a very strong emergency fund, you can actually take a risk of relaxing for some time also in future. So thinking poor is about financial discipline. Okay, so this is about the very important thing that then you need to know. Then now you can ask me, doctor, then my friends told me that for what the hell are you saving? Because one of my friend who is very fit and very saved all his money, but he died with heart attack, he died with this problem, he got cancer and all that. So for what are you saving? I'll try to explain you. See, you don't see all the negative stories in the world because in a population of 145 crores, people will die. People will get diseases. It is not that everyone is getting. See the good stories also. There is a family with two, there is a good family who is happy, who are staying, within their means, saving all the money, and they're going for good vacations once in a while. Not like see good stories also, no. And there is another guy who actually since he had a good emergency fund, he could actually take a 6 months gap. He cleared his European degree or MRCP or something like that, and then he is settled in a bigger position now. So why don't you see those kind of stories also? Why do you see only stories where somebody is dying and somebody is actually not doing good? So there will always be negative stories in 145 crores. So don't worry about all that. You see real world people who actually started small. So Devi Shetty is there, who has actually started with a small hospital focused on affordable cardiac care. Now Narayana Health is a big enterprise. Same Dr. Bhaskar Rao of KIMS Hospital, of Naresh Tehran of Medant, all these people started with one hospital, small setup, grew big franchises, and they built kingdoms only now. So all these people have not expanded immediately. They started small, they thought small, but it worked out. They started expanding slowly. In the same way, you should also do in your practice. Your small OPD might become a big maybe multinational corporate in future. Who knows? So that possibility also is there. So I'm not telling that you will not succeed. You will succeed only when you start small and grow organically, and then do everything step by step. So you are not here to practice only some 5 to 6 years, no? Some 25-30 years you'll be practicing. So step by step, consistent effort, and then be humble, have humility, and then you will grow. So that's about this thing. And then so if I sit with a podcast, which I will really do, I'll sit with all these big guys. They are actually coming into podcasts, I'm noticing. So if I sit with podcasts and with these big guys, and I'm pretty sure if I ask them, if I give you a time machine, what would you do? I don't think they will tell that they will make hospital again in 2025, because it is very competitive and saturated now. Even though India needs so many hospitals because we are 145 crore, but the thing is, it is a very competitive market now. I'm hoping they would say that at this point, if they're starting young like you, okay, they would maybe think about understanding how tech can be used in growing, understanding how tech can be used like AI or any kind of tech. So understanding the technology, and maybe they will build some kind of a business model where they will solve some problems which are existing with technology. Even then, I don't think they will actually scale up in 1 year only. They will start to solve some problem in the beginning, and then they will use technology, and then they will try to increase its size slowly. Over a period of 7 to 8 years to 10 years, you should actually develop some kind of a business model, is what I would feel. So these are the kind of things I can say that they would do now. So start small and then grow. So your blueprint should be start an emergency fund, have some money, and then don't unnecessarily spend all the money, and work lean. Okay, work lean. Start small OPDs. Start small. If you really want to tech business, start a very small thing with one engineer you collaborate. Start a small thing, address one problem, and then grow. Directly, people actually want to start a $1 billion startup. Funding and all these are not required. You really start something, not to exit. You really start something to grow, to solve a problem. That is the kind of people we want. We don't want somebody to start something and exit off and make some money. Money makes no sense after some time. You need to critically think and solve the problems which healthcare is having, and then automatically money will follow. Okay, even if money is not following, you will feel happy at the end of it that you have done something to the world. Okay, then specialize in one area. Don't tell that I'm one of the many so and so doctors. You always tell that you are the only one in that particular area. That is how you have to be. Only then you can do some kind of a research. Build digital presence, but not by fancy podcasts, calling all the high-tech guests and all that. With your cell phone, that's enough. Talk about the area where you have command in. Okay, and then people, if you have passion in something, people automatically say, they don't see the production value. They will see the content. So that's it, guys. So think small, think poor, and build big in future. This is what I can tell you. Thank you for following the video till the end. Thank you all. As usual, Dr. Dheeraj Masapu, logging off. Roger that.